This medication helps treat symptoms of too much stomach acid, such as stomach upset, heartburn, and acid indigestion. It also relieves symptoms of extra gas, such as belching, bloating, and feelings of pressure/discomfort in the stomach/gut. Simethicone helps break up gas bubbles in the gut, while aluminum and magnesium antacids work quickly to lower the acid in the stomach. It works only on existing acid in the stomach and does not prevent acid production. It may be used alone or with other medications that lower acid production. If you are self-treating with this medication, be sure to carefully read the package instructions before use to ensure it is right for you. Some products have similar brand names but different ingredients with different uses. Taking the wrong product could harm you. Ask your pharmacist if you have any questions about your product or its use. When taking Antacid plus anti-gas, it's best to take it after meals and at bedtime, as needed. Follow the directions on the product package or as directed by your doctor. If you have any questions, ask your doctor or pharmacist. If you're using the chewable tablets, be sure to chew them thoroughly before swallowing, then drink a full glass of water. If you're using the liquid form, shake the bottle well before pouring each dose and measure the dose carefully using a medication spoon/cup. Do not use a household spoon, as you may not get the right dose. Refrigerating the suspension may improve the flavor, but do not freeze it. The liquid form works best if taken without other fluids, but you can mix your dose with a little water if needed. It's important to talk to your doctor or pharmacist about how to schedule your other medications to prevent any interactions with Antacid plus anti-gas. If your acid problems persist or worsen after using this product for 1 week, or if you think you have a serious medical problem, seek medical help right away. If you're using this medication regularly for more than 2 weeks, ask your doctor whether this is the right medication for you. Some common side effects of Antacid plus anti-gas may include nausea, constipation, diarrhea, or headache. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. The magnesium in this product may cause diarrhea, while the aluminum can lead to constipation. If you experience diarrhea, using an antacid that contains only aluminum alongside this product can help control it. To minimize constipation, it's recommended to drink plenty of fluids and exercise. Diarrhea is more common with this product than constipation. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. Antacids containing aluminum can bind to phosphate in the gut, leading to low phosphate levels, especially if used in large doses and for a long period of time. It's important to notify your doctor if you experience symptoms of low phosphate, such as loss of appetite, unusual tiredness, or muscle weakness. Some serious side effects may include dizziness, fainting, slow/shallow breathing, slow/irregular heartbeat, mental/mood changes, deep sleep, or pain with urination. If you notice any of these, seek medical help immediately. While a serious allergic reaction to this drug is rare, seek medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you notice any other effects, it's important to contact your doctor or pharmacist. Before taking Antacid plus anti-gas, make sure to inform your doctor or pharmacist about any allergies you may have to aluminum hydroxide, magnesium, or simethicone. This product may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. If you have health problems such as frequent alcohol use, dehydration/fluid restriction, or kidney problems, be sure to consult your doctor or pharmacist before using this product. Antacid plus anti-gas may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this drug safely. Additionally, if you have diabetes, consult your doctor or pharmacist about using this drug safely as it may contain sugar. For pregnant women, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding. Be aware that antacids can affect the absorption of other medications, so it's important to consult with your pharmacist before taking antacids with any other medication. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential drug interactions. And remember, do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are phosphate supplements, such as potassium phosphate, sodium polystyrene sulfonate. Always consult with your healthcare professional before taking any new medications. If you suspect that someone has overdosed on antacid plus antigas and they are experiencing severe symptoms such as fainting or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. Make sure to attend all your medical and lab appointments. In addition to taking the antacid plus antigas medication, making some lifestyle changes can help improve its effectiveness. Consider joining stress reduction programs, quitting smoking, reducing alcohol intake, and making diet changes like avoiding caffeine, fatty foods, and certain spices. It's best to consult your doctor or pharmacist to discuss specific lifestyle changes that may benefit you. If you forget to take this product on your regular schedule, just take it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. Keep antacid plus antigas at room temperature, away from light and moisture. If it's a liquid product, you can store it in the refrigerator to improve the taste, but do not freeze it. Make sure to keep all medications away from children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard antacid plus antigas when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.